Hi, welcome to the Brain Injury Answers podcast. This is Dr. David Glazer providing the answers you need when a brain injury occurs. This podcast is for educational purposes only. For treatment, please consult your physician. This podcast does not represent the Department of Veterans Affairs. All right, let's get started. Question: what is the tube coming out of the patient's neck? Answer: the short answer is this is a tracheostomy tube. But what does it do and what's it about? And there are various types of tracheostomy tubes. So oftentimes after a severe traumatic brain injury or a moderate traumatic brain injury, a patient will have a difficult time breathing. As we know, the brain controls the entire body, and that includes breathing. In addition, when someone undergoes many surgeries, one needs to have a tube put through their throat into the lungs to allow them to breathe. So oftentimes, a tracheostomy tube will be placed directly through the skin on the neck into one's trachea, also known as the windpipe, which then allows for the easy passage of air in and out of a patient's lungs. It also allows for a breathing machine to be easily applied. As a patient hopefully recovers, it then allows for a patient to gradually be weaned off the tracheostomy tube until they're able to breathe regularly as they did prior to their injury through their nose and or their mouth. Looking at a tracheostomy tube, there are various different parts. So we'll start at the neck. At the neck, the tracheostomy is placed through a hole, oftentimes known as a stoma. Then the outer cannula, or also known as the long oval-like structure, goes through this stoma. After the outer cannula comes the inner cannula. The inner cannula is oftentimes directed through the outer cannula with the use of an obturator. The obturator allows the guidance of the inner and outer cannula into the stoma. Once the cannula is placed, the obturator is swiftly removed so that air can move in and out of the patient's body. You will then see a Velcro-like cloth that goes around the patient's neck, and both its ends on both sides of the trachea pass through a hole that is on the neck plate, which is oftentimes referred to as the flange. This strap then overlaps on itself and holds the trachea onto the person and keeps the cannula inside the patient's trachea. There are different types of tracheas. The most common are a cuffed and a cuffless. When a patient is on a breathing machine, like a ventilator, the cuffed trachea is oftentimes used. The cuffed trachea has a balloon that can be inflated around the cannula. This ensures air only passes through the trachea cannula and does not seep around the outer parts of the cannula. A cuffless trachea does not have this balloon around the cannula. In a certain way, a cuffed trachea can be deflated and essentially is acting as a cuffless, also known as a non-cuffed tracheostomy tube. There are also various sizes. Once a person is no longer on a breathing machine and is breathing on their own through the tracheostomy tube, they are often downsized to a size 6 tracheostomy. As one begins the weaning process of the tracheostomy tube, they are placed on a size 6 tracheostomy. They are then placed on a cuffless or a non-cuffed tracheostomy tube. And then eventually they are placed on a passenger valve, which is essentially a cap over the tracheostomy tube, which allows the patient to be able to start speaking. Air is able to come in through the passenger valve, and then the voice quality is then able to pass through the vocal cords instead of going back out through the valve. Because a patient with a tracheostomy tube that is fully open is unable to produce speech. After a patient is able to tolerate a passenger valve well, a red cap is placed over the tracheostomy cannula. This red cap does not allow any air to pass in and out of the tube. Therefore, a patient is fully breathing on their own, and speech is produced easily on their own. As a person does well with this, one will often have their oxygen rate measured throughout the night while a patient's sleeping. This allows the doctor and other caretakers involved to ensure that a patient is breathing properly at night and getting the right amount of oxygen at night. Once a patient is handling a red cap trachea well, then the tracheostomy is removed. This takes about 10 seconds. One just unstraps the Velcro from the holes on the flange or the neck plate, and it slides right out in most situations. One then cleans it, may use a little Vaseline gauze, or one may not. It's not necessarily needed. And one puts gauze over it and bandages it well, and one then now has a tracheostomy tube out and waits anywhere from 2 to 4 weeks as the stoma then heals. With the bandage over the stoma, it's possible for air to seep out if the bandage is not sealed well. So it could cause a little bit of speaking issues. But again, the stoma closes over the next 2 to 4 weeks, and one won't have to worry about having a tracheostomy tube there or having a hole there. So again, the overall summary is this tube protruding from the neck is called a tracheostomy tube. It goes into the trachea and allows for easy breathing. Over time, the tracheostomy tube is weaned off the patient, and the stoma, also known as the hole, is patched up, and one is able to then continue breathing as they did prior to the injury through their nose or mouth, and is able to talk regularly. And for those patients that are unable to be weaned off the tracheostomy tube, one can live with a tracheostomy tube. One can eat with a tracheostomy tube if one's swallowing muscles redevelop. And one can have the tracheostomy tube easily replaced within certain periods of time and one can easily have the tracheostomy tubes cleaned. That's a wrap for today. Remember to email all your questions to braininjuryanswers@gmail.com. Check out the website www.braininjuryanswers.com. Thanks for listening.